next let me discuss about the dialysis in drug poisoning. Now remember, certain drugs can be, certain drugs can be removed by dialysis. Alright, certain drugs can be removed by dialysis. However, dialysis does not filter the proteins. This is a very, very important point, right? So, dialysis doesn't filter the proteins. Alright, dialysis does not filter the proteins. Now, therefore, drugs having high plasma protein binding, for example, you take diazepam, they cannot be removed by the dialysis. Okay, so dialysis does not filter the proteins. So, the drugs which are highly plasma protein bound, they cannot be removed by the dialysis. Right, they cannot be removed by dialysis. Okay, next. Now, and I have given you the examples of those drugs which are having high plasma protein binding capacity. Now remember, the dialysis removes only those drugs which are present in sufficient free concentration in the plasma, right? I have said you that once the drug is administered, once it is absorbed in the blood, the drug will stay in two forms. One is the bound form, that is the one which is bound to the plasma protein, and the other one is the free form. The free form is the one which is not bound to the plasma proteins. Alright, so remember this point. Right, dialysis, it removes only those drugs which are present in free concentration within the plasma. Right, dialysis removes only those drugs which are present in sufficient free concentration in the plasma. Right, sufficient free concentration within the plasma. Next, the other point is, thus drugs having high volume of distribution are difficult to be removed by the dialysis. That is, now if the drug is present in the plasma, that too in the free concentration, that can be removed by the dialysis. Whereas if the drug is, majority of the drug is distributed into the tissues, and that particular drug cannot be removed by the dialysis. Okay, so thus, thus drugs having high volume of distribution, drugs having high volume of distribution, that means majority of the drug is present in the tissues, majority of the drug is present in the tissues, but less in the plasma, So drugs having high volume of distribution, where majority of the drug is present in the tissues but less is in the plasma, these are difficult, these are difficult to be removed by dialysis. These are difficult to be removed by the dialysis. Now what are those drugs which are having high volume of distribution, where majority of it is distributed into the tissues? Like for example, you take digoxin. It cannot be removed by dialysis because it is having high volume of distribution. Now you take verapamil. It is having high volume of distribution, that is why it cannot be removed by dialysis. Next, you take propranolol, which is a beta blocker. This is also having high volume of distribution into the tissues, that is why it cannot be removed by the dialysis. And then we have what is called as imipramine. So this also is having high volume of distribution. This also cannot be removed by the dialysis. So remember a point: digoxin, imipramine, propranolol, verapamil. These are some of the examples where they have high volume of distribution into the tissues and they cannot be removed by the dialysis, right? Now, the other point what you should remember here is, thus drugs having low volume of distribution right, drugs having low volume of distribution and the drugs which are having low plasma protein binding capacity, alright, drugs having low volume of distribution and the drugs having low plasma protein binding capacity, these particular drugs, right, these particular drugs, they are the good candidates for the dialysis. Right, they are the good candidates for the dialysis. Examples of it is your salicylates. Right, examples of it is your salicylates. So remember, the salicylates, they are having low volume of distribution and low plasma protein binding capacity. Right, so they are present in free concentration within the plasma and they can be easily removed by the dialysis. Okay. Now, let me shortly revise here. Certain drugs can be removed by the dialysis and dialysis does not filter the plasma proteins. That is a very, very important point. And the drugs which are highly plasma protein bound, they cannot be removed by the dialysis. And dialysis removes those particular drug which is present in the free concentration within the plasma. And the drugs having high volume of distribution, that is majority of the drugs in the tissue and less is present within the plasma, they are difficult to be removed by the dialysis. Examples: digoxin, verapamil, propranolol and as well as imipramine, they are having high volume of distribution, so they cannot be removed by the dialysis. So summarizing about the drugs and dialysis, drugs having low volume of distribution, that means the concentration of the drug which is restricted to the plasma, and low plasma protein binding capacity, that means the free forms, they are the good candidates for the dialysis and the example is your salicylates. Next, let me discuss about the clinical importance of the plasma protein binding. Right, let me discuss about the clinical importance of the plasma protein binding. Now let me discuss the clinical importance of the plasma protein binding. So, if you see the clinical importance of plasma protein binding. Now what are these plasma proteins? That includes your albumin and as well as the globulin and minor concentration of your fibrinogen. First, the duration of the drug will be affected depending upon the plasma protein binding capacity. So one is the duration of action. Right, one is the duration of action. Now remember, drugs with high plasma protein binding capacity, they are long acting. Okay, so the drugs whichever are having, right, the drugs whichever are having high plasma protein binding capacity, they are long acting drugs. Alright, why? Because more the drug is bound to the plasma protein, less of the drug will be metabolized. Right, more of the drug, if it is bound to the plasma protein, less of the drug will be metabolized. Right, and if it is not metabolized, the duration of action of that particular drug increases. So the drugs with high plasma protein binding capacity, they are usually longer acting. Next, the other thing is the plasma protein binding also affects the distribution of the drug. The second thing is the distribution. Right, the second thing is the distribution. So if you see the distribution, remember high plasma protein binding drugs, they stay in the plasma, thus they have low volume of distribution. Okay, so high plasma protein binding drugs, right, high plasma protein binding drugs, they stay in the plasma. Right, they stay in the plasma and they have low volume of distribution. Right, they have low volume of distribution. Why? Because majority of the drug, if it is plasma protein bound, that will not enter into the tissues, so the concentration of the drug in the tissues will be reduced, and that is why it is called as the drug having low volume of distribution. Next, the third thing is displacement. Right, the third thing is the displacement. Remember, highly plasma protein binding drug, right, highly plasma protein binding drug can be displaced by another highly bound drug. Okay, so highly plasma protein binding drug, right, they can be displaced by, right, they can be displaced by another, right, by another highly bound drug, right, by another highly bound drug. Next, the protein binding capacity of the drug also affects on the dialysis. Right, effects on the dialysis. Remember, if the drug is highly protein bound, then it is not effective for the dialysis. So remember, it is not effective for the drug having high protein binding capacity. Which is not effective? The dialysis is not effective. Okay, so dialysis is not effective if drug is having high plasma protein binding capacity, because if the drug, majority of the drug is bound to the plasma protein, that cannot be filtered across the membranes in the dialysis. So the proteins are not filtered across the dialysis membranes. So if majority of the drug is bound to the plasma proteins, that cannot be filtered or that cannot be crossed across the dialysis membrane, and they cannot be dialyzed. Okay, so this is the clinical importance of plasma protein binding capacity of the drug. Now we have discussed the volume of distribution, right? Now what did we discuss about the volume of distribution? Volume of distribution, we have said that what amount of the drug, right, what amount of the drug is entering into the tissues from the drug what has been administered to the individual. Okay, so if you take the volume of distribution, so what exactly you mean by this volume of distribution is, remember, how do we calculate the volume of distribution? It is calculated by dividing the plasma concentration of the drug whichever has been attained to the dose of the drug administered, right? So how is this calculated is, this is calculated by dividing, right, this is calculated by dividing the plasma concentration of the drug, right, this is calculated by dividing the plasma concentration of the drug which has been attained right, which has been attained to the dose of the drug administered. right, to the dose of the drug which is being administered, right. So if you take the volume of distribution, we can give this by a formula. Volume of distribution is equal to the dose administered, right, the dose administered, and that too by intravenous, right, the dose administered divided by the plasma concentration of the drug, right, divided by the plasma concentration of the drug. Okay, so this plasma concentration is given by CO. All right, so this is what is your volume of distribution. So volume of distribution tells you how much of the drug has entered into the tissues from the drug what has been administered to the individual. And so this is what is called as the measure of the distribution of the drug. So this is a measure of distribution of the drug, right, this is the measure of the distribution of the drug. So what I mean to tell you here is, if the volume of distribution is more, it means more amount of the drug is in the tissues and less is in the plasma, right. So if volume of distribution is more, right, if the volume of distribution is more, that tells that it means that more amount of the drug is present in the tissues, right, more amount is present in the tissues and less is present in the plasma, right, less is present in the plasma, right. Thus higher dose has to be administered to attain the same plasma concentration. So before going into further discussion, let me shortly revise here. Volume of distribution is, it is defined as the plasma concentration of the drug whichever has been attained to the dose of the drug which has been administered, and volume of distribution is the measure of distribution of the drug. And if the volume of distribution is more amount of the drug is in the tissues, less amount is in the plasma. So continuing with the volume of distribution, so remember, if the volume of distribution is more, it means more amount of the drug is in the tissues and less is in the plasma, right. So if the volume of distribution is more, this tells that more amount of the drug is present in the tissues and less is present within the plasma, right, less is present within the plasma. Now what I want to tell you here is, thus now for those drugs where the volume of distribution is very high, that means majority of the drug is going into the tissues, very less is present within the plasma. So what I want to tell you here is, thus if a drug is having high volume of distribution, higher dose has to be administered to attain the same plasma concentration for the drug having high volume of distribution than those having low volume of distribution. So what I want to tell you here is, the drug which is having high volume of distribution, right, the drug which is having high volume of distribution. Now this particular drug, this has to be administered in high dose, right, this particular drug has to be administered in a high dose to attain, right, to attain the same plasma concentration of the drug, right, to attain the same plasma concentration of the drug. Same means what? Same means the same plasma concentration of the drug having high volume of distribution and those having low volume of distribution. So to attain same plasma concentration of the drug having high volume of distribution with then those with low volume of distribution, right? Then those with the low volume of distribution. Okay, so what I want to tell you here is, if the drug is having low volume of distribution, it will remain within the plasma, it does not enter into the tissues. Whereas if the drug is having high volume of distribution, majority of the drug will go into the tissues, less will be in the plasma. Now if you want to have this particular high volume distribution drug to have the same concentration in the plasma to that of your low volume distribution drug, in such clinical scenario you have to give the high dosage of that particular drug. So when you are giving high dosage of those particular drug which is having high volume of distribution, then that will attain the same plasma concentration for drugs having low volume of distribution. Alright. Now this particular high dose, right, this high dose, this is called as the loading dose. Right, this particular high dose, this is called as the loading dose. Now remember, thus volume of distribution is the main determinant of the loading dose. Okay, so volume of distribution is the determinant of, right, it is the determinant of the loading dose. Right, it is the determinant of the loading dose. Now let me tell you, this is a very important multiple choice question. Now what is the drug which is having highest volume of distribution? So chloroquine, which is an anti-malarial drug. Chloroquine is the drug with highest volume of distribution, right, with highest volume of distribution, right, and how much is that? That is nearly around 1300 liters per kg, right, the volume of distribution is 1300 liters per kg. So this is about your volume of distribution, right. Shortly summarizing, the drug which is having high volume of distribution, majority of it is in the tissues, less is present in the plasma, right. So thus the higher dose has to be administered to attain same plasma concentration for the drugs having high volume of distribution than those having low volume of distribution. And this particular high dose, this is called as the loading dose. Thus volume of distribution is the main determinant of the loading dose, and chloroquine is the drug with the highest volume of distribution, that is nearly around 1300 liters per kg.